Now that your implant treatment is complete, it's important for you to know how to maintain those implants and how to keep them healthy and serving you for a long time. Let's start with the simplest case. If your implant was used to restore a single missing tooth, the easiest way to treat it is just like a regular tooth. You have to brush around it, floss around it, and ensure that you don't get food packed around the sides of implants. Sometimes, because the diameter of the implant is narrower than the root that it replaces, it makes it easier for food to get trapped between your teeth. Food that accumulates in those places can lead to gum disease, which can affect the implant, or it can lead to decay, which can affect the natural teeth around it. If your implants were used to restore a bridge, 3 or 4 missing teeth, it's important to treat it like a regular bridge as well. Brush and floss around the implants where you're able to, but in places where the implants are connected by means of a fixed bridge, you can get around it either by using a floss threader, a proxy brush, or something like a water pick that is able to clean out debris from below the bridge. Going up one level, if your implants were used to restore a full arch, for example an all-on-4 type treatment or implant bridges that span your entire mouth, it's even more important that you continue to maintain their health because these implants are really all that are keeping your teeth in now. Brush, floss wherever you can, or in places where you're not able to floss because the implants are splinted together, use the floss threader like we discussed earlier, a proxy brush, or a water pick to ensure that food doesn't stay underneath the bridge. Implant overdentures are some of the easiest prosthetics to maintain. All you have to do after every meal is to remove the denture, give it a wash, and rinse your mouth so that you don't get food accumulated there all day. In terms of cleaning the denture, brush the denture teeth as you would your own regular teeth, but it is important to brush the underside of the denture as well, the parts that are in contact with your gums. In the mouth, you will see small gold abutments which are meant to hold the denture in place. Use a soft toothbrush, go on the abutment and make small circular motions. This will help to get rid of the bacteria around the abutments and keep those implants clean. An important point to take note of is that the abutments as well as the components in the denture are subject to wear and tear. Over a period of time, you might find that your dentures get a bit looser. When that happens, come and see us to get it changed out so that you can get a tight fit again. One tip to extend the lifespan of your dentures is to put the dentures in place and use your fingers to click them down securely before you begin eating. Conventional denture wearers have a habit of placing the dentures in their mouth and biting them down. Doing so may seat your implant overdentures in the short term, but over a long period of time, it will increase the wear and tear on the components, and you probably will have to get them replaced faster. Finally, in terms of implant maintenance, it's important to see a hygienist every 6 months or however often you are recommended to. They are able to clean around the implants and ensure that bacteria doesn't build up around them. Remember, implants are anchored in natural bone, and just like regular gum disease affects teeth and bone, gum disease can also affect implants. If you lose bone around the implants, you lose the support that the implants have, and after a long period of time, the implant itself may fail. So maintenance is very important. Follow all these steps, maintain your own good oral hygiene, and see your hygienist regularly so that we are able to maintain your implants in function for a very long time.